How are you today?
I'm good. How are you?
I'm good. I'm here to assess your swallowing. So first I'm going to start off by asking you a few questions, okay? So on a rate of 0 to 4, 0 being no problem and 4 being a problem, I want you to tell me if you're experiencing any of these things, okay? So number 1, my swallowing problem has caused me to lose weight.
0.
Okay. My swallowing problem interferes with my ability to go out for meals.
0.
Swallowing liquids takes extra effort.
0.
Swallowing solids takes extra effort.
1.
Swallowing pills takes extra effort.
2.
I feel like it's pretty common. We can assess that later. Swallowing is painful.
0.
The pleasure of eating is affected by my swallowing.
1.
When I swallow, food sticks to my throat.
1.
I cough when I eat.
0.
Swallowing is stressful.
1.
All right, awesome job. Thank you for answering this to the best of your ability. I need to clean your table. All right, so what I'm going to do next is I'm going to have you try eating a few different foods and drinking a few different liquids. So this one is water, and this one is going to be a thickened water. And then we have oatmeal, applesauce, and chips. Do you like that stuff?
Yeah, we're all good.
All right. I've heard rumors that the oatmeal is pretty bland, so just be prepared for that.
Okay.
All right. So first we're going to test your alertness. So if you don't mind, if sticking out your thumb, I'm going to press on your nail bed. Does that hurt?
No.
Okay. Awesome job. Now, I want to just talk with you a little bit, and I want you to take a bite of any of the foods. Actually, let's start off with the applesauce. Just take a bite. Are you okay feeding yourself, or would you like me to do it?
I can do it.
Okay. Good job paying attention. How did you like that?
I really like applesauce.
Do you? Do you normally eat like a big jar of it every day?
Not every day. I'd say like once a week I have applesauce.
Okay, awesome job. I want you now to take a bite, and then I want you to touch your nose. Good job. All right. All right, now I want you to close your mouth and hold your breath for as long as you can. Ready, go. Good job, you can release. Awesome job. Do you feel like you're normally breathing most out of your nose or through your mouth?
Probably through my mouth.
Okay. Right now when we're having a conversation when you're eating, I see you breathing through your nose a lot, so that's a good sign. All right. Now, I want to hear you say some things back to me, okay? So first, let's try counting to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Awesome job. Now let's say pop, 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 pop.
Pop, 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 pop.
Awesome job. You're doing great. All right. Now let's try counting to 5, but in a whisper voice. But as you do it, I want you to get a little bit louder with every number, okay? So start off quiet and get loud.
1, 2, 3, 4, 5.
Awesome work. All right. So I'm not seeing any like excess saliva or anything. Do you feel a lot of like drooling or extra saliva throughout the day when you're laying down?
No.
No? All right, awesome. So I just want to take a look at your lips, just perfect. Now spread your lips and say E and then ooh.
E, ooh.
Good job. Now alternate between the two. So go E, ooh, E, ooh.
E, ooh, E, ooh.
Awesome job. Now let me hear you go pa, pa. Good. Now let me hear Paul prefers pink petunias.
Paul prefers pink petunias.
Awesome job. Good work. Now, I'm going to have you stick your tongue out as far as you possibly can and then bring it back in. So it's gonna look something like this. Your turn. Awesome job. Now let me see you touch each corner of your mouth with your tongue. So it's gonna look something like this. Good work. Now, can you act like you have food stuck on the side of your mouth and see if you can clear it with your tongue? So you're gonna go. Good job. All right. Now I want you to open your mouth wide and you're gonna raise your tongue up to the ridge of your mouth and then back down. So it's gonna look something like this. Awesome work. All right. So now I'm going to use my tongue depressor. I already have my gloves on. They're just invisible today. And I am going to push against your tongue, okay? So first I'm going to push laterally from side to side. So I'm going to apply pressure on one side and you're going to try to push the opposite way. Okay? So if you can stick out your tongue. Good job. Now I'm going to test this side. Awesome work. Now I'm going to put it on top of your tongue and you're going to try to push up. Good job. All right. Now I'm going to have you act like you're about to make the k sound. So the back of your tongue is going to be on the ridge of your mouth, and I just want you to hold it there, but with your mouth open so I can see. Awesome work. All right. So now I want you to try licking your lips. First we're going to go slow and then we're going to speed up. So it's going to look something like this. And then you're going to speed up and you're going to go as fast as you can, okay? Let me see. Nice slow movements. Now let's speed up. Good work. All right. Now let me hear you say ta, 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 ta. Ta, 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 ta. All right. Now let's go a little bit faster. Go ta, 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 ta. Ta, 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 ta. Awesome job. Now let's hear take Tim to tea. Take Tim to tea. Awesome job. Now let's hear ka. Ka. Ka, ka, ka. Ka, ka, ka. Ka, 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 ka. Ka, 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 ka. Good. Now let's try, can you keep Katie clean? Can you keep Katie clean? Awesome work. All right. Now I want you to take a bite of something a bit thicker. So we're going to try your oatmeal. And I want to see you chew a little bit of it up, and as gross as it is, I'm going to ask to see it, okay? Show me whenever you're ready. Good job. Got some nice bolus in there. All right. Now, when you're all done swallowing, I'm going to ask you to open your mouth again so I can make sure that you cleared all of the bolus. Good work. All right, now I'm going to take my tongue depressor with my gloves still on and I'm going to test your gag reflex, okay? I'm going to do it on your left and your right side. Good. Good job. All right. Everything's looking great so far. Now I want you to say, ah, and hold it for several seconds. Ah. Good job. We have a guest entering the room today. This is my emotional support dog, Willow. Hi, Willow. All right. Now I want you to say, ah, 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 and repeat it multiple times. Ah, 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 ah. Good job. All right. Now, let me hear you cough. Cover your mouth, though, please. Good. That was a very strong cough. All right. We already did the prolonged ah. So now I'm going to have you prolong S and Z. So we're going to go and then we're going to take a break. And we're going to go and hold it for at least 5 seconds, okay? Good job. Still looking great. All right. Now I want you to take one more bite, maybe of the oatmeal again, if that's okay.
Okay.
And then when you're done swallowing, I want you to say, ah. No rush, no rush. I don't want you to choke. Good job. Your voice sounds great. All right. Now, the last thing we're going to do with eating is I want you to take another bite, and I'm going to hold your throat underneath your chin, and I'm going to make sure that everything feels okay. Okay? Is that all right if I touch your throat?
Yep.
All right. Good job. All right. Do you normally feel yourself coughing after you eat or when you're trying to eat?
Not really, no.
Okay. I know you mentioned earlier that you have an issue swallowing pills.
Mm-hmm.
So is that just because of the size, do you think? Or do you think that there's not enough liquids? Do you take it with water?
I do take it with water. I feel like this size is an issue for me.
Okay. Maybe we can talk to your doctor about that and get some of your medications changed or something so you can get a smaller pill. But we can keep observing that. All right, so I think that everything looks great and I don't have any more concerns. Thank you for letting me assess you today.
Thank you.